This is WFYI News Now. It's November 25th, and I'm Drew Daudelin, filling in for Abriana Herron. On today's show, a $300 million development project in downtown Indianapolis, a charter school will not be coming to Hamilton Southeastern Schools, and 1 in 7 women who use birth control use it for non-pregnancy related reasons, but politics and misinformation worry some patients about the future of birth control access.
My doctor wanted to put me on birth control, but my mom said no because birth control is for sex only. So I wasn't able to get on it until after I had my son.
Those stories coming up, but first, law enforcement in Fishers and Carmel confirmed last week that they received reports that some residents awoke to anti-immigrant propaganda littered around neighborhoods. WFYI's Zach Castle has more.
The flyers contained xenophobic depictions of immigrants, urged them to leave the U.S., and served as a recruitment tool for a self-styled Ku Klux Klan branch based in Kentucky. Police in Fishers and Carmel said they don't want to give the group attention, but they did receive complaints and said the flyers were later cleaned up. Carmel's deputy chief, DJ Sheff, says this is likely a small group.
We believe that we know who the individual is that's dropping this off.
The pamphlets have been met with shock and concern, online and off. Gurinder Kaur is the CEO of the Immigrant Welcome Center. She says that members of the public should arm themselves with knowledge.
We have to definitely respond to this xenophobic act collectively as a community.
Police in Indianapolis and Noblesville said they were aware of the matter and were monitoring it. I'm Zach Castle.
A downtown development project is moving quickly through the city approval process. WFYI's Jill Sheridan reports on the new proposal that provides more than $15 million in city support for the $300 million development.
The redevelopment project raises the old CSX building to build a new hotel and entertainment venue across the street from Gainbridge Fieldhouse. The Metropolitan and Economic Development Committee recently passed a new tax increment financing or TIF proposal to help fund the project. Councilor Jared Evans voted in favor but noted the development could have gone further.
If the pandemic taught us anything, we cannot be a downtown of hotels. We have to have people living downtown. I would have loved to have seen this thing going up 20, 30 stories tall with the residential component a part of it.
Simon family development company Boxcar leads the project that includes a new 4,000-seat theater supported by Live Nation. The project in Indy's wholesale district received approval from a Historic Preservation Commission in September. I'm Jill Sheridan.
A charter school will not be in Hamilton Southeastern Schools anytime soon. HSC became a charter school authorizer in September. Shortly after that, an Iowa-based organization that helps start charters began to court the district. Superintendent Pat Mapes pitched this potential school to expand work-based learning and career tech choices. But some parents and community members pushed back. They worried the charter school could strip funding away from the traditional HSC public schools. This week, the organization pulled its charter application from HSC as a result. Mapes called it a missed opportunity. The district's teachers union said there's no place for charter schools in HSE. And for our final story today, birth control does more than prevent pregnancy. Individuals rely on it to treat a host of medical conditions. But birth control has become a hot-button issue these days, embroiled in political debates and misinformation. Side Effects Public Media's Elizabeth Gabriel reports advocates are concerned about what the future may bring for people's access to these medications.
Using birth control is life or death for Kendall Hantelman. When she was 23, her doctor said her bleeding disorder meant she had a 25% chance of dying if she got pregnant.
I started taking birth control to stay alive because the doctor told me that I would have better odds playing Russian roulette than getting pregnant.
She eventually got her tubes tied, but she went into ovarian failure, a rare complication from the procedure. Nearly 20 years later, she still relies on a hormonal birth control pill.
Now I have to take birth control again because my body doesn't make hormones anymore.
1 in 7 women who use contraception use it for non-pregnancy related reasons, like managing medical conditions. That includes blood disorders, endometriosis, and other diagnoses. Women like Sarah Slater. She's 32 and lives in Montpelier, a small rural town in Indiana. Slater got her period when she was just 9 years old. She had excruciating cramps and often changed pads in the middle of the night due to heavy bleeding. Misinformation about her birth control prolonged her pain.
My doctor wanted to put me on birth control, but my mom said no because birth control's for sex only. So I wasn't able to get on it until after I had my son.
Slater's experience with birth control misinformation echoes experiences that still go on up to this day. In fact, a recent survey shows that 17% of doctors from different specialties believe an IUD causes abortion. But research shows those birth control tools prevent fertilization and conception in the first place. Now, birth control misinformation has become a bigger issue as it enters political debates and influences lawmakers.
I think really a lot of this comes down to the misinformation about the definition of contraception versus abortion.
That's Lori Sobel. She is Associate Director for Women's Health Policy with KFF, a nonprofit health policy organization.
At the state level, we're more seeing other types of laws that could ultimately infringe on the right to contraception.
Debates around contraception in the U.S. have existed for decades. In the 60s and 70s, the U.S. Supreme Court ruled that married people and single women are allowed to use birth control without government restrictions. But some worry the tides may be changing, especially since the U.S. Supreme Court ended federal abortion protections when it overturned Roe v. Wade 2 years ago. Federal legislators in at least 17 states have tried to protect birth control, but they've been blocked by Republican lawmakers. Some Republicans say they support the use of contraception, but worry Democrats' attempts could be a gateway to allowing abortion. That leaves birth control users like Ash York fearful for the future.
I wouldn't be able to live a decent life.
Blackouts from period pain caused York to lose a job and fail college classes. Their contraceptive arm implant turned things around.
I don't want every time I try to enjoy my life or improve my life to backtrack because I'm in bed for 8 days.
Some medical providers are also worried. Maram Saeed is a minimally invasive gynecologic surgeon in Indiana. Saeed lists birth control as a necessary medication in her patients' charts. It's an extra step she now takes in case lawmakers restrict access to contraception in the future.
To even think that those situations would be limited is very scary for us as gynecologists and for my patients who rely on those medications.
For some, like Saeed, the results of the November election are casting doubt on the future of birth control access across the country. The first Trump administration allowed employers with religious objections to choose not to cover their employees' birth control. They worry what a second Trump administration may bring. Elizabeth Gabriel, Side Effects Public Media.
Side Effects Public Media is a health reporting collaboration of NPR member stations across the Midwest. It's based at WFYI in Indianapolis. That's all for today's episode of WFYI News Now. Our podcast is produced by me, Drew Daudelin, with support from the news team at WFYI and public media journalists across the state. Our news director is Sarah Neal-Estes. Kendall Antron produced our music. If you liked today's episode, remember to subscribe and share. And follow WFYI on Instagram, TikTok, Facebook, and YouTube to check in on our newsroom throughout the day. Thanks for listening. We'll be back tomorrow.